Good day, everyone. I am Sararania Justin Bridget C. from ABPD 2C. My topic for today is all about reason and impartiality as a requirement in ethics. Reason is the power of mind to think and understand in a logical way. It means that reasoning is how we use our brain. It helps us to analyze information in any certain situation, make connection, and how we draw a conclusion. Reasoning is important because we learn and grow to use reason by exploring new ideas and expand our knowledge. Impartiality is treating all people and groups equally, not partial or biased. So it means that impartiality, on the other hand, it involves the idea that each individual interest and point of view are equally important. It also called even-handedness or the fair-mindedness. Impartiality is a principle of justice, holding that decision ought to be based on the objective criteria rather than the basis of bias, prejudice, or preferring the benefit of one person over the other for improper reason. The role of reason according to Kant. Use of reason to ground morality is that it provides a response to the egoist. The use of reason to ground morality is that it explains the scope of morality. It means that reason helps us to see beyond our own self-interest and recognize our moral obligation. Reason also shows us that morality has a universal scope applying to all rational beings. Example: if it's wrong to lie to your friend, then it is wrong to lie to everyone. So the reason dictates that moral principle applies in all rational beings. Another example is helping someone in need, even if it is cost us time and effort. So, the moral action that the reason is dictate even if it doesn't directly benefit us. Impartiality in morality. It requires that we give equal and or adequate to consideration to the interests of all concerned parties. So it means that the principle of impartiality assumes that every person, generally speaking, is equally important, that is, no one is seen as intrinsically more than significant than anyone else. Impartial choice. It involves basing your decision on how all the person in that situation will be affected. It means that making decision that it considered everyone's interests equally, not just your own or those who people you favor. It's about being fair and unbiased in your decision making. Reason and impartiality are essential for ethical decision making. Example: hiring managers should use reason to assess candidate qualification. The impartiality is that to avoid favoring certain candidates based on their personal preferences.
Good morning, everyone. My name is Torres from ABPD2C, and my topic is all about 7 steps or elements of a model making a moral decision. The first step is gather the facts. Gathering the facts is the indispensable first step prior to any ethical analysis and reflection on the case. So, gather the facts, ang unang hakbang ay tinatawag na gather the facts o pangangalap ng impormasyon. Ito ay mahalagang yugto upang matiyak ang desisyon ay batay sa tamang kaalaman. Sa hakbang na ito, isinasagawa ang masusing pag-a-analyze ng sitwasyon bago magdesisyon. This problem involves step has been completed with the provided information about the patient's condition, his social context, and the potential risks involved. The next step is determine the ethical issues. The ethical issues in this case revolves around the conflict between maintaining patient confidentiality versus the duty to warn the sister of potential harm. The patient has a right to confidentiality, while the sister has a right to be informed about any risk she might face while providing care. The primary ethical issue is the conflict between the patient's right to confidentiality and the sister's right to be informed about potential health risks. The physician must balance the duty to protect the patient's privacy with the duty to prevent harm to the sister. The third step is to identify the principles that have a bearing on the case. So what principles have bearing on the case? Two ethical principles that speak to the case come out the way in which the moral issue is stated. Two principles are thus dominant. First is the widely acknowledged principle, and the second is the relevant to the case. So the case involves a conflict of ethical principles in the medical field, specifically the physician's duty to maintain patient confidentiality versus the duty to warn others of potential harm. The physician must balance these principles to determine the appropriate course of action. The two ethical principles that have a bearing on the case are the principle of patient confidentiality, which asserts that patients have a right to have their medical information kept confidential, especially information that could harm them if revealed. Number 2 is the duty to warn, which obligates the physician to inform interested parties other than the patient if they are at risk of significant harm. The case is about a conflict of rights, a conflict of duties that the physician has toward his patient and toward the sister. He is morally obligated to exercise compassion toward both, but what compassion or the duty to do no harm requires depends on which individual in the case is in view. The next step is list the alternatives. This step involves coming up with various alternative course of action as part of the creative thinking, including in resolving a moral dilemma. The problem involves resolving a moral dilemma by listing various alternative courses of action. The dilemma is whether to disclose a patient's HIV-positive status to his sister, balancing the duties to warn against the principle of confidentiality. Bagaman may ilang mga alternatibo na tatanggihan mo nang walang gaanong pag-iisip, sa pangkalahatan, mas maraming alternatibo ang nakalista, mas malaki ang pagkakataong ang iyong listahan ay maglalaman ng mga dekalidad na mga ito. Sa kaso, ang isang opsyon ay ang sabihin sa kapatid na babae na ang kanyang kapatid ay HIV positive. Ang alternatibong ito ay nagmumula sa pagsasaalang-alang sa prinsipyo ng tungkulin na magbabala bilang mas mataas na prioridad. Ang pangalawang opsyon ay ang tanggihan at sabihin sa kanya ang impormasyong iyon is nasa alang-alang na ang prinsipyo ng pagiging confidential ay may pinakamabigat na timbang, sa gayon ay sinusuportahan ang kahilingan ng pasyente para sa pagiging confidential. The next step is compare principles with alternatives. This step involves eliminating alternatives according to the moral principles that have a bearing on the case. To eliminate options that do not align with the moral principles in the case of Ray, a Hispanic male with HIV, we need to carefully assess each alternative against the principles of autonomy, confidentiality, non-maleficence, beneficence, justice, and compassion. Any option that fails to meet the principles should be removed from consideration. After evaluating each option against the moral principles, it appears that all the proposed alternatives align well with the principles. The medical treatment, beneficence, counseling and support, disclosure and education, community resources, employment and legal support, preventive measures. Since all the options align with the moral principles, none of them need to be eliminated. This indicates that a comprehensive approach incorporating all these alternatives would be the most ethical and beneficial course of action for Ray. The last step is to assess the consequences. If the principles do not produce a clear decision, then a consideration of the consequence of the remaining available alternatives are in order. Both positive and negative consequences are to be considered. The problem involves assessing the consequences of two opposing alternatives, telling the sister about her brother's HIV status or refusing to disclose this information. The goal is to weigh the positive alternative to make a moral informed decision. So that's all. Thank you.